Mar to invite me to this meeting. Thank you to Orthobiologix Clinics, TM Pain Warriors. I am very emotional because I am orthopedic surgeon and sport trauma, very enthusiastic in regenerative medicine. And I meet Dr. Sharmila last year in London in a very important meeting. And then we were together, we have a dinner, and we talked very, very much. And then in the cadaver lab, and I follow her long time ago in LinkedIn. She's very enthusiastic, and I like her passion for her job. Congratulations, Sharmila. She asked me about to talk a conference in the role of the use of PRP in the regenerative ligamentous injuries. You know, I am an orthopedic surgeon. I do a lot of procedures in regenerative medicine, in the clinic and in the O room. And I started, you know, with the arthrosis, and then I start to use it in muscle injuries, in ligament, in tendinopathies, and now I'm using even in nerve injury. And then my speech is talk about biological augmentation with PRP in ligamentous injuries. I will talk about my clinical experience in about 25 minutes or 30 minutes, and even a literature review. I work in Seville, in a beautiful town in the south of Spain. You have to visit. I have a clinic, it's SportMe Medical Center. You have the web, and we have the social meeting in SportMe Sevilla or Dr. Pedro Bernáldez, and even I am the director of the Spanish Academy of Regenerative Medicine, and you see the Instagram web page. Okay, let's start then. Like introduction, biological augmentation is a therapeutic strategy used to optimize tissue regeneration and healing. The PRP is used to enhance a biological repair through the release of growing factor and proteins that promote the cell proliferation, the synthesis of extracellular matrix, and angiogenesis. You can see this is my own room in my clinic in Seville. We are doing a reparation of the ACL, and always when we finish to do the surgery, we usually put the PRP of the patient to improve the heal and the integration with our unit, OrtoBioSevilla regenerative medicine. I think it's a practice. If you are expert in this kind of therapeutic, it's only 15 minutes to prepare. It's not very complex. I always used to talk with the patient about the relevance of to do this treatment. It's not a very expensive treatment, and for me, it's a very complement treatment to improve the healing of the ligaments. Okay, what are the objectives of this therapeutic in the ligament? The first of all is improve the quality of the tissue healing. Second, accelerate the functional recovery. Then, reduce the risk of ligament recurrence or failure. And the last one is avoid possible surgery. Then you can see in the left side the PRP preparation, and then an infography or systematic. We take off the peripheral blood, then we do the surgery, and finally we always put the PRP inside the tendon, the ligament, and in the bone tunnel, like femoral tunnel and tibial tunnel. Okay, this is the principle of the orthobiologic interventionists. But the question is, are all the ligaments the same? There is the same type of PRP or biological therapy. There are all the methods similar. We use the image guide control or blind system, which post-treatment revelation we use, because I have studied a lot about this tissue, and the literature is limited, although clinical results are promising. As always, the clinical results are in front or up of the literature. Okay, respect the question, are all the ligaments the same? We can say that not. Obviously, are not the ligaments the same, like the tendon or like the muscle, because the healing capacity of the ligaments is variable, depending of which one is affected and the severity of the injury. There are a number of reasons why healing injuries to the intra-articular ligaments of the knee is less reliable than healing of the extra-articular ligaments. By examining the healing response of intra-articular ligaments compared to the extra-articular ligaments, research has shown that there are no significant difference in the biological process of cell proliferation, cell migration, and collagen production. However, the process of fibrin clot formation has been shown to be deficient in case of ligament intra-articular injury. Without this clot, the torn ligament fibers remain separate after injury, and subsequent cells migration and tissues repair remodeling are affected. In addition, it has been postulated that the presence of circulation plasmin in the joint space, which is capable of breaking down the fibrin clot, is a reason for the formation of suboptimal or non-exist clots. Which types of orthobiological we have? Okay, we have three types of threaten, basically. The first of all is the tissue of this conference, the platelet-rich plasma. The high concentration of growing factor is thought to promote tissue repair and reduce inflammation. The most growing factor are that act in the ligament are PDGF, growing factor beta, insulin growing factor, fibrin growing factor, endothelial growing factor, as you know. And those different growing factors are different effects in the tissues. PDGF is an activator of mesenchymal cells, an important role in the repair and regeneration process. The beta DGF is cell proliferation, migration, and metabolism. Insulin growing factor is going about cell replication, glycogen, protein, and glycosaminoglycan synthesis. Fibrin growing factor important role in increasing cartilage, bone formation, and decreasing extracellular matrix degradation. And vascular growing factor endothelial, fundamental in the process of tissue repair regeneration. The second type of treatment, as you know, is mesenchymal cells. Is derived from sources such as bone marrow aspirate or adipose tissues. Those treatment has the ability to differentiate into various cell types, including ligamentous tissues. Their regenerative potential makes them a possible promising option for these injuries. However, the optimal protocol are still being researched. And then, the last type of treatment are scaffold-based therapies. Biomaterial scaffolds, sometimes combined with cells or growing factor, and designed to provide structural support and promote tissue regeneration in ligament injuries. Which is the idea? Mimic the native extracellular matrix, which facilitates cells binding and proliferation. While promising, these approaches are still in development and require further clinical validation. You can see an example of a scaffold-based therapy. It's called BEER, the branch enhanced anterior cruciate ligament. You can see this implant is between the bone and the ligament. And then we have the absorption. The implant is with blood, and then is going to improve the healing. Okay, let's go to the clinical application. In my personal experience, I do every month more and more PRP in ligament lesion. Which are the indication? Chronic or unstable sprains, medial collateral ligament injury in the knee, anterior peroneal fibula in the ankle, and medial collateral ligament of the elbow. And then partial ligament injuries in the ACL. The healing phases of several sprains promote the consolidation of the mesh tissue, complementary treatment in rehabilitation, where the tissue heals insufficiently or the patient exhibits persistent symptoms of instability. Those are my indication of the PRP in the ligament. Remember, ankle, elbow, knee, intraarticular and extraarticular ligament. You can see in this picture a reconstruction of ACL, and we put the PRP inside the tendon. You can see this is the reconstruction, and then we are putting the PRP inside the ligament. You can see it's called biological augmentation. You see that? And then you will see like the ligament is growing. And always we put in the tunnel, in femoral and tibial tunnel. Okay, let's see this video about a girl, very young girl, with partial rupture of ACL, and the treatment is 14 years old, handball, right knee sprain, complete ACL tears. You can see the MRI. And then it's a minimal unstable. We use intra-articular PRP. We set counting. We pour per 2 and 7 point of concentration. We put 5 billion of platelets. Ultrasound control aspiration. We can see the ACL with ultrasound. We know the anterior medial portal, palpate the femoral notch, and then we put 4 centimeters of PRP inside the ligament and 6 inside the joint. At 3 weeks, you can see more stable, and then the rehabilitation is very important. And after 2 months, you can see the girl has knee stable, Lachman negative, front they were negative, and goose muscle tone. And the control of MRI, good radiological evolution. You can see now in this control how very looks the ACL. And then it's a fantastic indication in partial ACL tears with minimal instability, especially in the third 2 months. Okay, we can use the PRP after the ACL reconstruction, as I told you before. And Dr. Miguel Sanchez is probably the doctor with more experience in the world. They recommended the use 3-4 cc inside the ligament and 6 cc intraarticular, and then physical therapy. This is a very good book. It's called Platelet Rich Plasma, about Miguel Sanchez, Eduardo Netuba, and Ramon Cugat, with indication in acute isolate MCL grade 2 and 3 injuries. You can see the medial collateral ligament, is extraarticular ligament in the knee. You have 2 and 3 tears, and then they recommend to put 4 to 7 cc PRP guide use infiltration always. I normally put a small account of local anesthesia, and then we put an antivalgus brace for 3 weeks, physical therapy and rehabilitation program. I have done 5 cases with good result. You have this patient, they had a total knee replacement, but he felt and he was a tear of the medial collateral ligament, and then I put the PRP in the ligament. You can see we are putting the PRP ultrasound guide as always, and the patient has a good result. Recently, I did the same with a military man, very good result. You know, this ligament usually healing normally, but with PRP, probably we accelerate the process. Other indication is in the contralateral ligament, the lateral collateral ligament. You know, this is more like a cable. This is more difficult to healing and normally has different injuries associated, but we can use in the acute partial injuries in the lateral collateral with bicep tendons avulsion, posterolateral capsular lateral meniscus. The treatment conservative would be use filtration with 4 to 7 cc PRP in the ligaments and its insertion, and again antivirus brace, physiotherapy, and rehabilitation. This is other personal case. This is a young people, young male with a small tear with a varus stress of the ACL. It's painful. In the ultrasound guide control, you can see, look at this. This is an echoic image with a normal image of the collateral ligament of the knee. And then we decide, because it's not very unstable, to put the PRP. We check the contralateral knee. This is the normal lateral collateral, and this is the tears. It's very easy if you have experience to check the difference between the normal ligament, in this case, a lateral ligament with the injury, and then we invite him to put the PRP inside the ligament and inside the tears. You see that? We are in the long axis of the ultrasound, and we are putting 4 to 7 cc of PRP. It's not a painful procedure, and then we use a brace, and sometimes we do repeat the procedure 2 or 3 weeks later. But sometimes with one injection is okay. But it's very important to talk with the patient, because sometimes you need 2 or 3 injections 7, 10 days apart. Other indication is very, very typical, is a chronic ankle ligament instability, or even in acute. This is a case, it's a very interesting case. It's a very young patient. It's always about 17 years old or 18, and he was in the wait list to surgery, to do a breastrum surgery, because she was an ankle, an unstable ankle. But I decided to put multiple left ankle input, complex ATP tears. I decided to put the protocol 3 injection intra ligament. You see that even a bone avulsion in the talus is typical. We see 6 millimeters. And the 3 session, after 6 weeks, the patient reports a stable ankle and no more sprain. A good aspect of the ligament. You can see that. It's a very good aspect of the ligament. And I talked with him, do you want to surgery? And they say, hey, no, doctor, I have eye satisfaction, very high. And then he returned to play tennis without surgery. And then my thinking is to think in this treatment. If you have a ligament injury, you have to talk with the patient, because some ligaments have the ability to natural healing. And with the PRP, we can help the ligament to healing before. I am really, really surprised with the ligament. In conclusion, optimization of healing condition by biological augmentation with growing factor may lead to the formation of superior quality reparative tissue, although evidence-based research to conclusively support such treatments remains preliminary. The keys: adequate patient selections, restoring blood supply, stimulation angiogenesis, produce an appropriate bioformulation and dosage, propose combination of PRP with cells therapy, biological. Sometimes we combine bone marrow aspirate with PRP. Protect the healing ligament, maintain stability, instituting an appropriate goal-oriented exercise progression. We usually count the cells with an hemocontour, and you see that the white blood cell, there is no white blood cell, red blood cell, there is no red blood cell, and the platelets, the beginning was 140, and now there is 275. We have concentrate plus 2. Its application can be performed both on an outpatient basis using ultrasound guide infiltration in the partial lesion and in the surgical context, especially in the ACL reconstruction or reparation, improving graft integration and postoperative recovery. Clinical evidence, barriers, and a standardized treatment protocol have not yet been established. Ongoing research and clinical trials are essential to determine the efficacy, safety, and optimal application of these therapies in the treatment of ligament injuries. Thank you very much for the invitation. You have my family. This is a memorial to my father and my grandfather and my grand-grandfather 1 month ago with the governor in government in Seville. And it's a really honor for me to continue the tradition of orthopedic surgery. We have 4 generations of orthopedic surgery, more than 120 years in Seville, and I am very honored for me. And we wait for you in Seville. You are invited to visit our clinic, and thank you very much for all of you.
Thank you very much.
Wonderful. Yes,